Your Excellency, Mrs. Abebe Gobena, State Minister of Health, Federal Democratic Republic of Ethiopia, Your Excellency, Lub Yacob Atumani, Minister of Health, Comoros, Your Excellency, Ahmed Ali Bazi, Minister of Economy, Industry and Innovation, Government of Comoros, Ms. Zainab Gura, Ministry of Permanent Secretary, Deputy Permanent Secretary, Ministry of Health, Kenya, Mr. Tom Menge, Director of Ministry of Trade, Kenya, Dr. Loko Abraham Bongase, CEO of Rwanda Medical Supply, Dr. Mohammed Ali Mohammed, Permanent Secretary of Ministry of Health, representing the Minister of the Government of Djibouti, Dr. Letitia Lydia Yasmane, Permanent Secretary of Ministry of Health of Madagascar, Dr. Bernard Valentin, Permanent Secretary, Ministry of Health, Seychelles, Ms. Astrid Tamatav, Permanent Secretary, Ministry of Finance, Trade, representing the Minister. Mr. Yosef Bahalabi, Representative of Ministry of Health of Eritrea, Ms. Bibi Reziwani Maula Bokos, Permanent Mission to AU and ECA of Mauritius, Hamjambo. Hamjambo. I'm learning my Swahili. Karibu sana. So my name is Abebe. I'm representing Africa CDC. I work with Africa CDC in the local manufacturing department. I'm now the acting lead for local manufacturing at Africa CDC. First of all, I would like to thank the United Nations Economic Commission for Africa for bringing us here today. And I would like to thank all the participants who devoted their time to come here and participate in this important meeting. Africa CDC, as you know, is a young organization. It's only 7 years old, established in 2017 on the heels of the West African Ebola outbreak. The primary focus for us is to respond to emergencies and epidemics on the continent. Every single year, we respond to more than 150 emergencies happening in all corners of the continent. During the 7 years journey, Africa CDC has helped member states to respond to outbreaks of different types, ranging from infectious disease, COVID-19, Marburg, Ebola outbreak, and also non-infectious or non-disease hazards or emergencies happening on the continent. So we all know that during COVID, Africa was on the end of the line in terms of accessing important materials, countermeasures, IPCs in the global market. So it has given us a lesson that Africa needs to invest in developing, manufacturing, and trading vaccines, therapeutics, and diagnostics for its own health security. In response to what happened during COVID-19, the African Union established partnerships for African vaccine manufacturing, PAVM, with a clear and bold goal of manufacturing 60% of our vaccine needs in 20 years. In 2022, we came up with a 20-year strategy. We call it a framework for action, the continental strategy, to reach to our goal of manufacturing the 60% vaccine need in 2040. So the framework for action has 8 pillars. These are the enablers that we think will take us to our goal of manufacturing the 60% vaccines. These are the market shaping and demand intelligence, the regulatory, R&D, workforce development, tech transfer and IP, regulatory, infrastructure, and access to finance. At the center of it is agenda setting and coordination. So for us in Africa CDC, these 8 enablers will help us achieve our objective of manufacturing on the continent. At the center is agenda setting. Africa CDC is mandated to convene, coordinate, and mobilize resources for member states. And also, we're mandated to set agenda for manufacturing for the continent. Over the last couple of years, Africa CDC, together with partners, have started operationalization of the framework for action, the 20-year program, the 20-year plan for vaccine manufacturing on the continent. So we have operationalized the bold programs. I would like just to mention a few of them, just to give you a context of what has been done in terms of achieving our objectives. As you know, one of the critical enablers for manufacturing is training, workforce development. As we speak now, we have only about 3,000 full-time employees of R&D and manufacturing on the continent. But for us to achieve our 60% objective, we need more than 12,000 full-time employees in manufacturing and R&D. So there is this big gap in terms of qualified workforce for manufacturing. So in this respect, we have developed a competency framework for R&D and manufacturing on the continent that clearly shows what exactly we need to achieve our objectives in terms of workforce for manufacturing and R&D. In addition to developing and launching the competency framework, we have supported training of more than 100 experts from Africa so that they could have first-hand short-term training in Asia and in the United States. Moving forward, we can't depend on sending experts to outside of Africa to get the training. So currently, we are localizing training, workforce development on the continent. So we're now in the process of establishing a regional center of capability and capacity center. We call it RCCN. The expression of interest will be on air either today or tomorrow. The idea is to have regional centers coordinated by Africa CDC and taking students and giving trainings on different aspects of R&D and manufacturing. And we'll be selecting these centers from the existing centers in all corners of the continent. In addition to workforce development, we also work with our partners, AfCFTA-anchored and MRH, to strengthening regulatory on the continent. Without a strong regulatory system, we can't achieve our manufacturing objectives. As my colleague always say, AfCFTA-anchored, colleagues from AfCFTA-anchored, there is only one standard. There is no such a thing as African standard. There is only one standard, that's international standard, and we will stick to those standards. We don't want to cut corners. So for us, how we can do it? By strengthening our regulatory system. So regulatory can be strengthened at the 3 different levels. At the country level, by working with national regulatory authorities. At the regional level, harmonizing regulatory at a regional level. And then when it comes to continental level, we will be working with the newly established African Medicines Agency. That's how we would like to approach regulatory strengthening for manufacturing and R&D on the continent. So far, we have done a few activities together with AfCFTA-anchored in terms of strengthening regulatory on the continent. We have supported a few national regulatory authorities so that they could have the necessary equipment to do the vaccine laboratory so that they can have the quality control system for lot release on vaccines. We will continue working with other national regulatory authorities in supporting them to achieve the maturity level 3 and if possible above level 3. When we started, we had only 2 national regulatory authorities with the WHO maturity level 3. Now we have 5 member states that have achieved maturity level 3 of WHO. Another critical factor in terms of regulatory is WHO pre-qualification. So as you know, the pre-qualification is taking too much time and resources, so that our manufacturers are struggling to get there. Unless they have the required pre-qualification, they won't be able to access a market. So for us in local manufacturing department, our finish line is for manufacturers to access international market. So in February this year, we brought together member states, partners, and national regulatory authorities, together with WHO and AUDA NEPAD. And we had a meeting in Addis Abeba to discuss what can be done to fast-track WHO pre-qualification, so that our manufacturers will be on par with other manufacturers from other parts of the world and get access to the international market. We'll continue working with national regulatory authorities and also regional economic communities in terms of strengthening regulatory. The other critical enabler for manufacturing is access to raw materials and input materials. Unless our manufacturers have uninterrupted supply of raw materials and input materials, again, they won't be able to achieve the manufacturing objective they have. So in partnership with CEPI, Coalition for Epidemic Preparedness Innovations, we have been working on ensuring access to raw materials and input materials for our manufacturers. Again, in February this year, we brought international suppliers together with partners and member states in Nairobi, and we presented to them our roadmap, the draft roadmap in terms of ensuring access to raw materials and input materials. We will soon operationalize the roadmap that will enable manufacturers have uninterrupted supply of raw materials on the continent. Another interesting work that we have done last year is the suppliers landscape. As we know, thanks to COVID-19 pandemic, there is very good political will in terms of expanding manufacturing on the continent. But political will is one important step, but we need more coordination and alignment. We don't want to have a situation where manufacturing facilities are popping up in every corner of the continent without alignment and coordination. What we have done last year together with Chai and Path is to analyze the ecosystem, the landscape, how the manufacturing landscape looks like. So we found that there are so many manufacturing facilities either being established or in the process of establishment or ready to manufacture. We have about 23 manufacturing facilities on the continent. The big majority of these manufacturers are at early phase of manufacturing in the establishment process. A few manufacturing have done the infrastructure and they're waiting for technology transfer. Again, another few, 3 or 4 manufacturers, they're ready to manufacture vaccines in the coming 2 to 3 years. So why we've done all this is to understand what kind of support we should be giving to manufacturers. There is no one size fits all. So we will be supporting, I call them the front runners, different from the ones in the middle and different from the ones who are just starting manufacturing. The bottom line is we need coordination and alignment. We don't want to be in a situation where all the manufacturers or the majority of the manufacturers do just fill and finish the last phase of manufacturing and no one is doing on drug substance. That's a disaster in the making that won't give us a kind of sustainability that we need to have in Africa. So we want to have a distributed manufacturing where you have some of them manufacturing the drug substance and others do the fill and finish or a combination of it, so that we can ensure health security and manufacturing security for the continent. Again, last year, Gavi, the Vaccine Alliance, made a very good decision, very transformative decision of availing up to $1 billion for African vaccine manufacturers. That's innovative financing mechanism that will be operationalized very soon. Next month, on the 20th of June, we will be launching AVMA, African Vaccine Accelerator, the Gavi $1 billion program in Paris, together with member states from Africa and Europe and partners. That will give us a kind of funding boost for our manufacturers so that they can plan ahead and plan for the coming 5-10 years, even longer. Again, this year in February, the African Union heads of state during the annual summit made important decisions. Three important decisions concerning vaccine manufacturing or manufacturing of health products on the continent. One, Africa CDC is now mandated to coordinate manufacturing of not only vaccines, but also therapeutics, diagnostics, and other health products. So now we're mandated to coordinate manufacturing of, I can say, all health commodities on the continent. Second decision was the establishment of the mandate given to Africa CDC to establish and run a pooled procurement mechanism for the continent. That's why we're now gathering here in this beautiful Mombasa. Third decision is the approval of the President of the Republic of Kenya, His Excellency President Ruto, to be the champion for local manufacturing on health commodities in Africa. Now we have a champion, a president who will take our agenda to the international venue and help us in advocating for manufacturing on the continent. So I'm not gonna go to the details of the pool procurement mechanism. My colleague Wesley will give us the technical details, but I would like to just mention that the pool procurement mechanism, we call it APPM, the African Pool Procurement Mechanism, will be established and led by Africa CDC with the support of UNECA and Afrexim Bank. So we'll be working, the three organizations will be working together to set up the design of the pool procurement mechanism together with our partners. I can mention UNICEF, our critical partner on this, and also other partners globally and on the continent. We'll establish the PPM and run the PPM led by Africa CDC. So moving forward, we acknowledge the work that UNECA have done so far since 2019. We're very much informed about it, and we'll be aligning our PPM with the CPPM that UNECA have been working on. So our approach for the pool procurement mechanism is that we'll take the pool procurement mechanism in a stepwise fashion. We'll start in a small scale, startup phase we call it, and then move to the medium scale, expanding phase, and then finally a mature phase where we will try and procure as many products as possible and serving as many member states as possible. Having said this, I would like again to thank you for coming, and I wish all of us a successful 3 days in Mombasa. Thank you.